Hi everyone, welcome to PharmaGrid. So today we will continue with the remaining clinical oriented patient profile based type of questions. So starting with question number 6, a hospitalized patient with systemic infection is receiving intravenous antibiotics. He also has hepatic and renal insufficiency. After receiving medications for 5 days, he is found by nursing staff to be jaundiced. Drug toxicology profile is obtained and indicated drug levels of 10 times the acceptable value. Which of the following drug administration schemes is most likely to explain this situation? So the options are continuous IV infusion, once weekly IV injection, single daily IV injection, twice daily IV injection, twice weekly IV injection. So here the correct answer is option D, that is twice daily IV injection. So this twice daily IV injection is responsible for the toxicity due to this drug. Twice daily drug administrations cause the highest amounts of drug available in the body. In a patient with hepatic and renal insufficiency, drug metabolism is compromised, and within a few doses using this administration scheme, high levels of drug in the body will be noted. The remaining other options are wrong because the option A, continuous IV infusion, it will result in steady state drug levels in the body, and option B, it is once weekly IV injections which will result in lower amounts of drug in the body with peaks and troughs. And the option C is single daily IV injections. It will result in lower amounts of drug in the body but will also have peaks and troughs. And the option E is twice weekly IV injections. It will result in higher amounts of drug in the body as compared with twice daily IV injections. Next question. A 40-year-old man is brought to the emergency department after suffering a cardiac arrest while in a shopping mall. His blood pressure is 70/40 mmHg and his pulse is 40 beats per minute. He is given a dose of intravenous epinephrine. Which of the following reactions is necessary to induce a biologic response of increased heart rate? So that means what is the mechanism of action of this intravenous epinephrine here? The options are detrusor contraction, drug receptor complex formation, hepatic oxidation reaction, renal arteriolar contraction, splanchnic nerve stimulation. So here the correct answer is option B, that is drug receptor complex formation. The epinephrine must be recognized by a receptor to induce a biologic response. The drug will bind to the receptor. So in this case, these are the beta adrenergic receptors. A drug receptor complex is formed and hence a biologic response is achieved. So here in this patient, the biologic response is increased heart rate and blood pressure. The remaining all other options are wrong. The option A, that is epinephrine, does not cause detrusor muscle contraction and also it is not metabolized by hepatic oxidation reactions. Then the option D, while renal arteriolar contraction occurs with epinephrine, this is not the basis of its cardiac effects. And the option E is splanchnic nerve stimulation and it is also not the basis of tachycardia induced by epinephrine. So the next question. A 59-year-old female with diabetes presents to her primary care physician for routine follow-up. Her current medications include insulin. Her fasting blood sugars are in the range of 80 to 120 mg per deciliter. The intracellular effects of this medication are likely caused by which of the following mechanisms of action? The options are changes in ionic concentration within the cell, changes in membrane potential, protein phosphorylation, protein and receptor phosphorylation, receptor destruction. So here the correct answer is option D, that is protein and receptor phosphorylation. So in this case, this patient has diabetes and takes insulin. This medication, which is a hormone, functions via the insulin receptors. The transmembrane signaling mechanism for insulin involves protein and receptor phosphorylation. And about the other options, the option A, so an example is that cholinergic nicotinic receptors signal via the changes in the ionic concentration within the cell. Then cholinergic nicotinic receptors signal via changes in the membrane potential, and alpha adrenergic receptors signal via protein phosphorylation. And the option E, which is receptor destruction, that is not a mechanism of transmembrane signaling. Okay, so the next question. The therapeutic index of a drug is the ratio of the dose that produces toxicity to the dose that produces an efficacious response. By this definition, which of the following medication has the largest therapeutic index? The options are diazepam, digoxin, gentamicin, lithium, theophylline. So here the correct answer is option A, that is diazepam, which is a benzodiazepine. Diazepam has a large therapeutic index. A large number of patients achieve therapeutic effects that are desired and a much smaller percentage of patients have adverse effects. Then option B, which is digoxin, it has got a narrow therapeutic index and requires frequent drug level monitoring to limit adverse effects associated with its use. Then option C, which is gentamicin, it belongs to aminoglycoside antibiotic, which has a narrow therapeutic index. Frequent peak and trough levels are drawn during therapy to minimize potential toxicity. Then lithium. Lithium also has narrow therapeutic index and requires close monitoring of levels to limit toxicities. Then option E is theophylline, which belongs to methylxanthines, which acts as a bronchodilator. It also has narrow therapeutic index and requires frequent monitoring of levels to limit its adverse events. Question number 10. A 47-year-old HIV positive male with hepatic insufficiency and renal insufficiency presents to his primary care physician complaining of dysuria. Urine culture reveals greater than 1 lakh CFU per ml of Escherichia coli pan sensitive to all antibiotics. CFU means colony forming unit. Which of the following would be the most appropriate treatment for this patient? The options are chloramphenicol, erythromycin, gentamicin, penicillin, rifampin. Here the correct answer is option D, that is penicillin, which would be the most appropriate treatment choice for this particular patient. So, an explanation for this answer is that penicillin is the best choice antibiotic in this patient because of its large therapeutic index. It is safe and common to give large doses greater than the minimal required doses even in patients with hepatic and renal insufficiency. Then remaining all other options are wrong. The option A, which is chloramphenicol, it would have a narrow therapeutic index in patients with hepatic insufficiency. Then option B, erythromycin, which is a macrolide antibiotic, it would induce the cytochrome system in a patient with hepatic insufficiency and induce toxicity. Then option C, which is gentamicin, it is a nephrotoxic antibiotic and should be avoided in a patient with renal insufficiency. Then option E, which is rifampin, it is metabolized by the cytochrome system and should be avoided in patients with hepatic insufficiency. So we have completed today's question discussion series. Thank you everyone for watching this video. Have a great day.